Okay, so we will start today's session. Welcome you all for once again for the final session of orientation to postgraduate synopsis proposal writing. Basically, the synopsis that needs to be submitted to your universities and the board. So we have completed five series. In the series, we have completed five sessions. Today is the final one. We have Professor Sumana BS as a chairperson for today's session, which will be mainly dealing with use of AI in research and writing the proposal by Dr. Ravi Kiran. Before that, I would like to introduce Dr. Sumana. She is Senior Consultant Pathologist at Manipal Hospital, HAL Airport Road, Bengaluru. She was Professor of Pathology at Vaidehi Institute of Medical Sciences and Research Center, Bengaluru, Professor of Pathology at Sri Atal Bihari Vajpayee Medical College and Research Institute, Bengaluru. Member to the Specialist Board Pathology of NBEMS, Ministry of Health and Family Welfare, Government of India. Reviewer for many national and international peer-reviewed journals. She has had over 12 publications in PubMed Index national journals. Her area of expertise include oncopathology, cardiothoracic and vascular pathology, lung and heart transplant pathology, breast and endocrine pathology. So welcome, Dr. Sumana. I have known her for the past, like all other faculty who have come here earlier also during these sessions and our previous sessions. She also has been my close professional colleague as well as a close friend, and we still interact on many interesting features. And I must say, she is one of the pathologists in the country who handles very tough histopathology. I cannot explain beyond this because that's not my specialization, but she gets referrals from all over the country, and she is wife of a famous cardiothoracic surgeon in Manipal Hospital, Dr. Devanand, who happens to be my junior in KMC Hubli. So welcome to you, Sumana, and thank you for accepting our invite and sparing your time. So over to you. Is the slide visible?
Yes, ma'am.
Yeah, okay. Over to you, Dr. Sumana. Thank you once again. I request you.
Thank you for the kind introduction. Good evening to one and all. I would like to introduce Dr. Ravi Kiran. And before that, for speaking of the topic today, it is the use of this artificial intelligence in the academic studies and thesis writing. And Dr. Pratibha Madam has done a commendable job in bringing these series of sessions to you all so that it will help the postgraduate students. And for today's topic, it is the artificial intelligence which is available. The tools are available for use in the academic studies and thesis writing process. But if the the artificial intelligence is permitted to be used, you use it, but do not blindly trust the technology. And with this few words, I would want Dr. Ravi Kiran to take you through the session. And I take pride in introducing Dr. Ravi Kiran, who would say when to use this AI tools, how to use it, and which AI tool to use, and how to select that AI tool carefully. And I expect this session will be very a feast to all the postgraduate students here.
Yeah, you can introduce him.
Yes, ma'am. I'm not able to see the slide.
See the slide? Oh,
no, ma'am.
Is it? Okay, okay. Just a minute. Ravi, I think you should. Are you sharing?
I have his details. I can still introduce, ma'am. Not to worry.
No, I will.
Dr. Ravi has completed his MBBS. Dr. Ravi has completed his MBBS training from Vaidehi Institute of Medical Sciences, and I'm proud that he's my one of my student. And he's done his MS General Surgery from Jawaharlal Nehru Medical College, KLE Academy of Higher Education and Research, Belgavi. He has done his GNB in General Surgery, and he has secured his Association of Minimal Access Surgeons of India fame, and he's got the Diploma University in Laparoscopic Surgery from University of Strasbourg, France. Currently, he is a specialist in laparoscopic and general surgery, and he is associated with Manipal Hospitals, Bangalore. His academic interests are in clinical research and surgical outcomes, structured data and documentation in surgery, and use of artificial intelligence in medical research. I welcome you, Dr. Ravi Kiran.
Thank you, ma'am.
Yeah, before he starts his, am I audible?
Yes, ma'am.
Yeah, before he starts his this thing, Ravi Kiran has been, again, I would take pride in introducing him a little bit. He has been my ICMR student in 2015. And from then on, we are in constant touch. And he has been one of the instrumental persons for me to set up my own company, I should say. Because we started thinking about this way back in 2019, where we planned something, but it came into existence 2018. It came into existence in 2022, but we have been closely associated since then, and I must appreciate he has got great interest in research, and many more things to talk. We'll do as he runs through the slides. After he completes, I can take little more time talking about his achievements. Over to you, Ravi. You can start.
Yeah, thank you, ma'am. Ma'am, can you see my slides?
Yes. Before
So,
we start, Doctor, can we all come on the video quickly? We take a screenshot, and then because Shashidhar may want to leave, okay, can you come on all of you? Can you come on the video mode? Yeah, all of you. Quickly, we take the screenshot. Everyone, 7 more. Dr. Preeta and 7 more. Quickly come on the video mode. Yes. Thank you. You can go ahead.
thank you, ma'am.
Yeah. You can share.
Yes, ma'am. So good evening, everyone. So today I'm going to talk about use of AI for PG dissertation, when to use and when not to use it. So most PG students don't fail their dissertation because they lack knowledge. They fail because they don't know how to use tools properly, most of the time. And right now, the most important tool is AI. So to be honest, even I have been using AI. I use AI too. And early on, I made many mistakes with it. I trusted outputs I shouldn't have. I didn't verify things I should have. I'm telling you these rules today because today specifically, because I've been on the other side of the learning curve. That's so that's why I'm trying to explain all these things to you. Uh, so what will be covered today? So the AI landscape. So what's out there and how it works, where AI will help. So and I'll show you a few demonstrations of few AI models, AI tools that we can use, and where we are not supposed to use AI or how we are not supposed to use it, and what journals, universities, and NMC require basically in the decision framework. So the AI revolution is already here. That is almost 180 million plus users of ChatGPT are there. More than 75% of researchers now use AI writing tools, and new AI research tools are released every month. So what are your peers right now using? So ChatGPT is the most common, Claude, Gemini, Notebook LM, Mandalay, and Grammarly, and many more. So the question is, will I will I use AI? It's not how do I use it wisely and ethically? Okay. So without guidance, the use is haphazard. There's risk of academic sanctions, weak foundations, and etc. So with guidance, we'll be able to achieve all these things today. So how AI language models work in plain terms. This is going to be a very short thing about how AI works, following which we'll talk about how we should use it. Okay. So you ask a question. So summarize this paper, refine my research work. Then what does AI do? AI predicts the best words. It's trained on billions of documents. It completes patterns. It does not understand most things. Most of these models don't understand all of it. What they do is they recognize patterns and arrange words, right? So output looks authoritative, that is, even when it's wrong, the language is fluent and confident. So we must verify it. AI has no way to know if it is wrong because it's only seeing patterns and patterns of words, what words are commonly seen beside what words, and it's giving you an output. Okay, so what are the tools that I'm going to demonstrate today? So I'm going to show you how to use ChatGPT, Claude, Notebook LM, and Manly. Okay, so types of AI. So not all AI is same. So we have mainly three different types of AI. So one is machine learning, one is deep learning, and one is generative AI. So what is machine learning? It is what will happen, right? It predicts patient outcomes, ICU deterioration alerts, surgical complication risk, readmission models, things like that. So basically it's predicting post-operative complications from pre-op data, things like that, right? So deep learning, what is it? So when when AI tries to interpret something like a CT image or an MRI or a histopathology slide or an ECG pattern, it basically tries to recognize a pattern. That is deep learning. Okay. So what is generative AI? Generative AI is where it helps you write or polish your words. It summarizes documents. It helps you frame research questions, things like that. Okay. So AI basically it is used for predicting rather than causation, right? So AI and machine learning predicts outcomes where it tells us that the patient is likely to develop a particular complication. It's based on patterns in the training data and statistical probability. So biostatistics, RCTs, they prove relationship. That is, this drug reduces mortality by 20%, things. And it's based on controlled experiment and it is based on inference of data. Okay, so treating AI predictions as proof of causation is wrong. That is, it is trying to predict things which are not there. That is, it is trying to find patterns in data. Whereas when you do an RCT or when you use biostatistics to find something, it is actual concrete data where you're finding something. Okay. So now where can AI help us? So let's talk about that. So so the thing is, um, it can be used for literature discovery. That is to find relevant papers faster than when we do a manual search. Paper summarization. That is, dozens of abstracts can be gone through quickly. It can summarize it into a table, and we can use writing and language polishing. That is, it can correct the grammar, the clarity. It can rephrase your whatever you have written, and it can help you write better, right? And research question sharpening. That is, it helps you identify gaps in your research questions, finds where there might be problems, and help you form a better phrase and a better research question. So AI can also be used to as a teaching aid to understand why a test is used and things like that. Okay, so literature discovery with AI. So the thing is, uh, we normally, where do you search for papers? You search on PubMed, you search on Google, and basically Google takes you to either PubMed or different other websites where you have to go through many abstracts and find the relevant. So some places you'll find a paper but no, you'll find an abstract but no paper, and you have to find the relevant papers. You have to use mesh terms to find and everything. So when you use AI, you can try to find more papers more easily. Basically, it can do a better search of all the literature available that is freely available online. Okay, so it can so you can use things like Notebook LM or PubMed to map the landscape of your topic. Then you can refine it. You can connect different papers to explore citation networks. Okay, you can ask AI to summarize abstracts for exclusion relevances. Okay, you can, but the thing is, you have to verify. When AI tells you a particular paper, you have to actually go to PubMed and verify that the paper actually exists. Okay. And so structure, that is, you can ask AI to identify themes across your included papers. Okay. So writing and language policy, like I have given you an example here. So say you have typed this phrase, um, the patients what was included in the study were having diabetes for more than 5 years duration, and they were operated laparoscopically for cholecystitis. Now you can use AI to polish that further into slightly better language. That is, patients with a diabetes duration exceeding 5 years who underwent laparoscopic cholecystectomy for acute cholecystitis were enrolled in this study. So that phrase is better, right? You can, it is giving a better, uh, complete phrase where you've included where the duration, okay, what surgery was done, why was it done, and that they were enrolled. Okay, so the golden rule is AI improves how you say it. The ideas, data, and conclusions must be yours, right? So we are in the draft, we have already told that the patient diabetes for more than 5 years, operated laparoscopically for cholecystitis. So the idea is ours, but AI has polished it into a better frame. Okay, so for research question sharpening, that is, tell AI your broad area, ask it to challenge your assumptions. That is, you can basically imagine AI like a person you're having a discussion with. So you can use it to identify gaps in existing literature. Okay, you can see what's wrong with the research question, and ask for 3 alternative phrasings for your hypothesis. So all this will, it's like you're discussing with somebody, but that someone can be wrong. Like any other human, if you're discussing with your friend, that friend can be wrong. The same thing here. Okay, so understanding statistics, right? So you can ask AI to explain why a test is appropriate for your data type, why use it to understand statistical outputs in plain language, and what does a man-Whitney test, what does it mean? So man-Whitney test or student t-test, when you say what does it mean, how does it how um, in the data you have or you have collected, what is the context? So this will help you explain things, right? But you should never ask AI to choose your statistical test. That you should do yourself. Okay, so visualization and presentation, so you can ask AI to present a comparison table effectively. That is, it will take all the data, make it into a table, and present it for you. Get suggestions for the right chart types for your data. Have a critique a graph, like what is unclear. Like basically, this is like you're talking to a person. You've made your synopsis and you've given it to your friend and asking what's wrong. Go through it. Tell me what's wrong with that. Is it clear? Do you think there's any gap in it, or do you think something is unclear? So all these things AI can help you, right? So AI improves the efficiency and not the understanding. The thinking still requires it to be you. Unless you know what you're doing, AI will give you things which are completely wrong, and you'll not even know that they're wrong. So I want you to hold this through everything what you're about to see. Every tool we demonstrate is a tool that amplifies your intelligence. It does not replace it, right? So let me show you some tools. Okay, so first is ChatGPT. That is one of the most commonest tool that is available. So the world's most widely used AI tool is ChatGPT, right? So what you can do, you can refine research questions and you can brainstorm ideas, get plain English explanations, critique your draft methodologies, and etc. Right. So the participants today, anybody can give me some what specialty you are in and what your rough topic for your thesis is? Anybody?
Yeah, open up. I think we had given this exercise now. Choose some topic.
Anybody? Just tell me what
Just
branch you are.
randomly. Yeah.
Sir,
Yeah.
my branch is
Okay.
Not audible, Richa. Yeah.
You said your branch is microbiology.
microbiology, and my topic, which is like going on, the discussion is still going on, is
Just give me a rough topic.
Yeah.
I can't hear.
She's
Others, can you just
typing
message?
PICO research question. She's messaging.
Okay, so let me just say that microbiology, your broad area is, let's say, antibiotic resistance, right? So this is a prompt that I have kept, right? I'm a PG student in microbiology, okay, at a teaching hospital in India. My broad area is antibiotic resistance. Give me a clear PICO research question, a null and alternate hypothesis, two feasible study designs. So I've asked ChatGPT this. This is the prompt. The prompt you give is very important. So this is what I've typed. Is it visible?
Yes, sir.
Okay. So let's see what ChatGPT says. So, okay. So here is a practical MD DNB friendly topic framework within antibiotic resistance that is feasible in an Indian teaching hospital microbiology department. So the clear PICO research question, what did it tell us? So P is population, hospitalized adult patients with culture confirmed E. coli UTI. Okay, it has basically, it's giving you an example, right? So I is exposure or intervention, prior antibiotic exposure in the last 3 months. C is comparison, that is no prior antibiotic exposure in the last 3 months. O is outcome, isolation of multi-drug resistant E. coli. So it has made a hypothesis for us. Okay, there is no, so null hypothesis is there is no significant association.
One second, Ravi. Can you please focus on the question, research question, what it has given, starting? Okay, hospitalized patient, adult patients caused by E. coli. Does prior antibiotic exposure in past 3 months compared with no prior antibiotic exposure increase likelihood of isolating MDR strain? All right, please go ahead.
So this is the research question that it has created
Yes.
because we have asked for it, right? So because we only gave it information that we are in microbiology, broad area is antibiotic resistance. So it has found this research question, okay, and so it has given a null hypothesis and an alternate hypothesis, okay, and two feasible study designs, okay, where hospital-based case control study, where, okay, so why is it feasible, main analysis, basically everything that we normally have a discussion about, right? So it has gone through multiple papers in that topic and it has found some gap in literature and it has given it to us.
So what does the participants, the students tell about it? Are you satisfied with this?
Participants can open
Anybody?
up.
Yes. Dr. Richa, microbiology postgraduate.
Yes, ma'am.
Are you happy
Uh,
with this research question? Are you feel? Are
uh,
you feel?
See
ma'am, I
this,
feel
this yeah,
more
go ahead,
can
go
be
ahead.
done.
So you should not be satisfied with the first output. You have to give more information and instructions. So more
The
you offer to the tool, and that is called the prompt engineering, if you agree, Dr. Ravi.
Yes, ma'am.
Yeah.
And whatever this version of research question hypothesis it has given us, this might be 100% wrong. We don't know, right? This is just some random words that AI has picked up and it has given it to us. Just 1 minute. Huh? Okay. So AI has picked up and it has given it to us and it has put it in few words, right? So this might be completely wrong. It looks completely real. It looks completely feasible, right? But it might be wrong. So you have to actually go through it. It's like some random person has told you a topic. You're not going to do your thesis on that topic, right? You're going to see whether it's actually feasible and go do it. But this is somebody extra, somebody out of the way is telling you some ideas. Okay. And you can always ask it more questions and it'll try to give you the answers. So this is just going to help you in identifying a topic. And you have to read every word and decide whether it's actually true or not, because it might be 100% wrong. There's no guarantee. Okay. So let's say now we can say you want to do a literature search, right? So now we'll do a literature search. So to save time, I've just created these prompts and kept ready. Otherwise, you have to type them. So I'm asking it to find key findings, main controversies, and research gaps in the studies from whatever is above in the last 5 years.
ChatGPT is thinking.
So,
It gave thinking.
ma'am, again, that's a misnomer. It's not thinking, it's
I
just
know.
finding patterns.
I think
It can be 100% wrong. But the way it presents it to us, it looks you'll
very-
start to doubt yourself.
yes, yes,
If you think it is wrong, it's wrong.
correct.
Just because ChatGPT has told you these are the findings, it doesn't have to be true.
True.
Okay. So basically,
So
this
do not
will
blindly trust the technology, is what
Yes.
I feel.
yes. So basically, it has gone through the last 5 years of papers that are freely available online, and it has given us some write-up. Okay. So in the previous studies, what all were there, independent or major associated risk factors for EBS cell producing. So basically ongoing debates, right? It has gone through, given us some references. If you press here, then you can go to PubMed. I'll give you that paper. Okay. So this is just helping you do a Google search better. Okay. So evidence gaps, whatever, basically this is whatever we have asked for. Because what did we ask? We asked for, just a minute. We asked for main findings, ongoing debates, and evidence gaps. So it's gone through it and it has given us a particular write-up. Okay. So you should always imagine that a second year MBBS student has given you this write-up. They can be wrong.
Mhm.
Okay. So it has given you references. You can go to that reference, open that article. Now, if I click on that, now it has opened up the PubMed paper. Now, what you do, it has basically made searching for papers easier. That's all. So now you open PubMed. This is true. Whatever, once you open it on PubMed, then you can read through this, understand. So it's just helping you read something or find more data better. Systematic way. I'm not a microbiologist, so I'm not too keen with all these topics. So I'm just going through it very fast. Right. That's the problem. If I try to do things which I don't know about. Now, when you go through your topic in your department, you should actually know something and then only use it. Then you'll be able to know what is true and what is not. Okay. So that's basically ChatGPT you'll use for this. Okay, most of the times it is for helping you write better and search different topics, different summarize papers, things like that you can use. But it can be wrong. Okay, so the ChatGPT being wrong, it's called hallucination, right? So it's not true, but it has presented to you in a way that you feel that that is true. That is nothing but hallucination, right? So ChatGPT regularly invents paper citations that look real but do not exist. Okay, so never cite a reference without actually opening that. It might give you a citation in the proper format, but it might be completely wrong. Okay, so unless you enable basically browsing, basically once you start using ChatGPT, you can enable different features. Okay, and you'll it can search online, search through your browser, things like that. Okay, and one problem with ChatGPT is it doesn't tell you that it has a doubt or it is making things up, right? You have to figure that out. You have to use your judgment to figure it out. Okay. So next, another commonly used AI tool is Claude. So Claude is slightly better for research. Okay. So it is better for anything related to research because it might tell you that it's not sure about a particular topic. Okay. It can handle more documents. Okay. It uh, and you can use it for better analysis, writing feedback, structured thinking tasks, things like that. Okay. So let me just open Claude and I'll try to show that to you. 1 minute. Anybody is not understanding anything, you have to tell me. Okay.
If any of you have already started using, you can give your opinions also.
How many of you use AI? Anybody?
Anybody is using AI? Dr. Preeta, you can share.
What do you
Chinmay
use?
is also. Chinmay also. Both of you can. You want them to open up, Ravi? You
Yeah.
want them to? Yeah, Chinmay, you can share your. She's final year PG. Today she will be a panelist. Yeah,
Hello,
Chinmay, go
Dr.
ahead.
Hi, ma'am. No, I just wanted to answer. Definitely, like Dr. Ravi Kiran has made all the points. So while I was writing my thesis, also definitely when writing a synopsis, also ChatGPT, Perplexity, and Gemini, all of these were very useful. But like he mentioned, we will be the ones who know the most about our topic, since we would have clinical correlation and we'd have more hands-on data than it does. So definitely it helps with the framing, grammatical corrections, and paragraph layouts and what should come afterward, that sort of thing. But ultimately the creativity lies with us. So that was what I understood when I was writing.
Did you get any outdated output? Were there instances like that?
In some places, yes, ma'am. There were a few references which were not really adding up, but that I kind of made out because it didn't come up when I did a web search or a PubMed search. So definitely that is one thing to watch out for.
Yeah, that is, you would always need to check the citation. If the correct citation is used by the chat GPT, that is one thing. And sometimes the data, what is given, may be outdated. What is the most recent is what you would know in your field. That is also important, isn't it?
Yes, ma'am. That's very true.
Yeah, Dr. Ravi will address all those things and tell you how efficiently, how you have to overcome that, what you have to do, all those. If you all come up and open up and tell this what been used for the research proposal and the final years, the second years, all of you, if you are open and actively participating, it will be more useful to each one of you.
Yeah, you can go ahead, Ravi.
So now I have uploaded my synopsis from when I was in PG, right? Whatever synopsis I had. Now I'm asking Claude, so please go through my synopsis. Let me know if there are any logic gaps. Okay. Or let's see what it says. So Claude is slightly better for anything related to research, and for us, Claude might be better because it'll tell you that it's not clear on something, which ChatGPT doesn't. Okay. So I did my PG in 2020. AI was not there. Okay. So now this is the first time I'm also doing this, and it's telling me something.
Can we zoom it a little bit? Yes.
So, okay, let's see what it says. I've gone through your synopsis. Okay, it's well structured overall, but there are some gaps and suggestions worth addressing. Okay, so it says that my hypothesis is underdeveloped because I state we hypothesize that adhesions are causing peritoneal pain at the site, but this isn't formally listed as a hypothesis in the objectives. So either frame is okay, or drop the language from the need for study section. Okay. So the PAI's peritoneal adhesion index scoring mentions only 10 regions, but the grading table shows L bowel to bowel. The test. Okay, so it's telling me what mistakes are made, which till now even I have not realized. Okay. So basically, I just wanted to show you that it can go through something and tell you that there might be mistakes. Again, this might be wrong. You have to read through all this and actually cross verify. It's like you have given this to a friend, they've gone through the document and they've told you this is wrong, that is wrong. I think you should make this change. Again, you use your intelligence, your understanding of the topic, and discuss with your guide, discuss with the other seniors, and then decide whether you actually have to do it or not. Okay. So basically, it has gone through everything and told us what are all the gaps. The prevalence estimates 0.01. Okay. So minor gaps. It has summarized everything. So it says my study design, the issue, there's some issue with it. I have to change it. Okay. High priority, VAS assessment, high priority, unexplained Z score and P value is moderate. PI reliability, okay, moderate. Hypothesis, not formally, okay. Follow-up duration 15 days, too short for adhesion symptoms. So few of these are right. Okay, if I was to rewrite it, I think I would have used all these inputs to rewrite it in a better way. Okay, so yeah, I just wanted to demonstrate how to actually use one of the tools. Okay, let me just go back to the. So I think I've shown you both ChatGPT and Claude. So refining research questions, ChatGPT will do a better job. That is what most. There are few papers on AI for research, so that I got this information from that. Okay, so long document analysis is better with Claude. Okay, writing polishing is better with Claude. Both hallucinate. So both, whenever they have found references, both can be wrong. You have to do it yourself. Okay, or whatever references it has told you, you have to cross verify. Right, you have to always go back to PubMed and see whether that paper actually exists or not. Okay. Another very good tool that is there is Notebook LM. Okay. So the good thing about Notebook LM is there is no hallucination. Okay. Because the data it uses is the data you have uploaded. Okay. So I'll just demonstrate that to you. Again, I'll use my synopsis. Just a minute. So let's go to Notebook LM. So I'm going to say create new notebook. Okay. Now I'm going to upload my. Anybody has used Notebook LM here? Any of you have used Notebook LM? Okay. So this is a very good. Yeah. Okay. Vinod, what anything you want to talk
No,
about your
Somebody has
experience?
used, Vinod has used.
yes, I used it for the notes, sir. Like I'm a student. I'm a second year PG from pharmacology, sir. So I uploaded my standard textbooks. So I if while preparing for a seminar or everything, sir. So I just like asked a notebook LM to like summarize the table, like give the classifications, the main topic, everything, sir. So that I used it like
Okay.
that. It gave me the gist of all the topics and the same main topics, and it also gave me a tabular forms of everything, sir, from the
Okay.
only and different type of books, sir. So,
Okay. Okay. So basically, Notebook LM one way is very good. This is a free software. Most of you can use it mostly free. There's a paid version also, but free software is good enough for us. So see, I have uploaded this particular PDF, right? So I am going anything so it's like I can discuss with this book. Now this book is a person. Now this PDF, my synopsis is a person. I can ask it any question and it's going to answer. And it's going to only answer with whatever data is there in that PDF. So there is no chance of any hallucination. Okay. And it's also, you can make a PPT, you can make a video, you can make an audio podcast. Okay. So it's going to make a podcast like two people are discussing about the topic. Okay. So basically, so whatever now I've asked, how do additions form and impact patient health after surgery? This is a question I've asked. Whatever answer it's giving is from the PDF I have uploaded. Okay. So I am talking to that PDF. So you can upload any PDF or any YouTube video, and basically it's like you're talking to that video or you're talking to that book. Imagine that book as a person and you're talking to the book. It's only going to give you information that's there in that book. It's not going to make up anything new. So basically this is to help you understand topics better. Now to write your synopsis, to do your thesis, what is important is understanding the topic. So right now I can ask any question to this PDF. If it's there in that, it's going to give me. If it's not there, it's not going to give me anything because it's not there in that PDF. Okay. So let's come back to this after some time. I've asked it to generate an audio overview. I'll show you how that works. Okay. Also, you can make flashcards. Okay. I think I'll zoom in a bit. You can make a video. You can make slides. There's something called mind map, right? I think it'll take some time to do all that. Okay. So basically you can ask it any question you want and you're asking that one particular document. So that's the brilliant thing about Notebook. Okay. That basically, okay. So I think the mind map is ready. So see, so it has created something called a mind map. Can you see this? So general information, need for study, objectives, methodology, tools and screening, statistics. If I click on general instructions, it is 1 minute. So it's basically whatever information I've kept. Need for the study, from the need for study that I have written in my synopsis. So it says common cause of small bowel adhesion, obstruction is 75%, random formation after abdominal surgery, difficult diagnosis via imaging labs, risk of emotional distress and misdiagnosis. So that's why I had to do that. That was the need for my study. These were the main points. So if I click on objectives, am I moving this too fast?
no, sir, it's fine, sir.
Okay, so this is basically whatever I had written in my PDF, right? My synopsis. It has broken it down into a mind map. That is a flowchart, a logical flowchart. So methodology, study design, sample population, inclusion, exclusion criteria. So basically this software will help you understand topics better and for you to learn these topics. This per se, you cannot use it to make your synopsis, but for you to understand a particular topic better, this is very useful. Okay. Just see. Okay, so it has Can you hear the podcast?
No.
Just a minute. Okay. Can you hear?
No.
No.
Okay.
Separately, you have to share it?
I think I have to share it separately. We'll do it
Yes. Yes,
later.
later. Yeah.
Okay. So getting back. So this is the other. After this, there's one more tool that I want to talk about. Just a minute. So Notebook LM, we have basically this is what I've told you. Next one is Mandalay. This is also a software that's very helpful. You can start using it from the time of your synopsis writing into writing of your thesis. Basically, this will help you cite different articles better. Okay, so I'll just show you how it works. This is the last one of the last ones I'll show you. Just 1 minute. Just 1 minute. So say this is Mandalay. These are all the papers that I've added to it. Okay, you can say add reference. You can upload a PDF of the paper, or you can upload it manually, or find something. If you find a paper, you can add a basically a tool in your browser to add it to your Mandalay list. Okay, so once you add all those papers to your list, it basically looks like this here. Okay, you can add another add-on to your Word document. Say now I have written something about so abdominal TB, and I'm typing something, right? So imagine you have typed your something in your synopsis. Now I have to give it a reference. Okay, I can just add the reference, insert citation, and then it says 1. Right now I'm typing something else. Something. Okay. So I'm going to add another citation. Okay, this is the paper. I'm going to add the citation. It's going to do it itself. Now at the end, whenever I want the references, okay. So here you can decide which style you want, whether it's Vancouver style or what style you want. Okay. Now if I say insert bibliography, now it has added the bibliography. Okay. Now say I have changed this particular reference. I get it up. This is one of the big headaches that we have, that once you add a citation, if you decide to change the order, you have to redo the entire list of citations, make sure the numbers are correct and everything, right? So if I just say update, it's supposed to reorder. Okay. Okay, I think. Okay, slight glitch like any other software. Okay. So basically you can try it yourself. Okay. Once. Yeah, you wanted to, Vinod?
Sir, the same thing we can do it in Zotero also. So,
Yeah.
by your experience, which is better, sir? Like from your experience, Mendeley or Zotero, which is easy tool and we can use.
So I have been using Manley from a very long time. I haven't used Zotero, so I'm not too sure. I've been using Manley for almost 5, 6 years. Now even an AI option has come up. I haven't yet tried that, but Manley I've been using. The thing with Manley is it is an Elsevier software, so I feel that it's going to the quality of it is going to be better compared to other softwares. Okay. And most of the time it picks up other papers better. It has a better database where you don't have to enter all the papers manually.
Okay, sir. Yes, sir. Okay.
Okay. So
Sure.
that's the reason I've been using Manley. I haven't used Zotero, to be frank.
Okay, sir. Fine, sir.
Okay. Yeah.
Thank you, sir.
No problem. So getting back to our presentation. So I've showed you now how to so what are the things that query papers you've collected? That is already you have the paper, then you can use Notebook LM, right? You can go through that paper using Notebook LM. It's going to make a mind map. It's going to make a podcast, okay? And you'll be able to go through it better. So refining a research question, that is you're talking to someone like another person next to you to discuss. You can use Claude or ChatGPT. Okay, to for writing and language polishing, Claude or something called Grammarly, which I have not demonstrated, but that's also there. Okay, for synopsis, section review, these sort of things, you can use Claude. Okay, and reference management, I have been using Mendeley, so I've been used Zotero, but Mendeley is pretty good. Okay, so never find references using AI. Even if you find something, you're supposed to cross verify, because it's going to look so real that you will start doubting yourself. That's the problem with AI, right? You have to cross verify. Okay. So wrong AI use, academic failure. The examiner won't blame ChatGPT. They'll only blame you. If something is wrong in your thesis, your synopsis, you have made something wrong in your synopsis. You can't sit and blame. I used ChatGPT that told me this is the reference, and now that reference is not there. Right. So I want you to think of one thing you've already done using AI that might fall into this category, right? So we don't, unless you cross verify, you'll not know that it's actually untrue, okay? Because it'll look so real, okay? So why AI can mislead you, okay? So first is data bias. Most AI models are trained on Western data and not much of Indian data. Okay, so an outcome prediction built on American patients will not apply to Indian patients at a government teaching hospital, right? Overfitting, that is a model that looks perfect on its training data set may fail badly when it's used in a different population. That is, it doesn't work everywhere. Hallucination, as I told you, generative AI predicts likely text. It does not look up a fact. So it will just think next to say, if I want to say why AI can mislead you, it is only finding what is the most common next word that is next to mislead. So mislead you, it's not, it hasn't. So if an AI has written that, it's not writing with meaning, it's writing with predicting the most common words around that particular word you're writing. Okay, so that's why there can be a context mismatch, and obviously no accountability. You can't go back and say I used ChatGPT or Claude that has given me this. Okay, so when not to use it, generating or fabricating data. Obviously, you're supposed to find your own data. You're supposed to find the patients, search, collect the data. You're not supposed to use AI to fabricate. Okay, obviously you're not supposed to fabricate it manually also, or using data, or using AI. Okay, so submitting AI as an original text, original work. So if you have used AI these days, for most journals you have to disclose what AI you have used and where. Okay, so here's hallucinated reference citations. As AI chat box generate fake citations. Never cite a reference you have not personally verified and checked. Okay, so replacing statistical understanding, that is using AI to run or interpret your analysis without understanding it yourself. Okay, so and then writing ethical approvals or consents. You have to do it yourself. You cannot use AI to write a consent form. Okay, so what not to ask AI? This is hard and fast rules. Again, generate your references? No. Choose your statistical test? No. That you have to decide with the help of a statistician. You have to decide. Write your result section? No. It cannot do intellectual work, right? Interpreting data is your intellectual work. You have to understand what data you have collected and you have to write it yourself. Delegating it to is fraud. Okay, so copy paste AI as your methodology. No, you should do it yourself. Use AI without disclosure. Okay, so what is hallucination? So when an AI language model, that is like ChatGPT or Claude, it generates something that is factually incorrect but presents with complete confidence. Now look at this. This particular reference looks completely normal. It has the author's names, it has a title, it has a journal, it has everything, page numbers, DOI, everything. But if you actually search this, it doesn't exist, right? But if you look at this in the data that it has generated, it looks completely normal, right? So you should be very careful. And another thing is, if you use AI, everybody will know that you have used AI. There are so many tools that will detect AI with 100% accuracy. Okay, I'll demonstrate you one tool, that is GPT-0. Okay, right now most universities use Turnitin or iAuthenticate to go through the manuscripts that you have submitted. Okay, the thesis you have submitted or your synopsis for detecting AI and also for plagiarism checks. Okay, so I'll just demonstrate how it looks. Just a minute. Now let's take something that we know is generated by AI. So can you see my screen? Let's copy this. This is GPT-0. So it has detected that this is generated by AI, 100% AI. Okay, you try to make mistakes, you do something, you remove few words, you do whatever you want, it'll still detect it that is generated by AI. Okay, so if you use AI completely to write your paper or to write your um, uh, proposal or your thesis, it's going to be detected as AI. You have to write it yourself. AI tools are basically to help you do this particular job in an easier and more systematic way, and to help you like a friend, not replace you. Okay.
Another 7 to 8 minutes,
Okay, ma'am. Yeah.
Ravi.
Yes, ma'am. So ethics and disclosures. So as I told you, multiple journals and universities, they require you to disclose AI if you have used. Some prohibit AI. Okay. And you should be careful and check with whatever institution you are in. Okay. Another thing is patient data and AI. You are not supposed to paste any of this data into AI. That is patient name, age, gender, address, hospital ID, IP numbers, OP numbers, diagnosis, operative findings. All these are patient identifiers. You're not supposed to put any of this into AI. So what can you do? That's what I've shown you here. What can you write it as? See, my study has 140 patients, mean age 42. That's okay. Incidence of additions was 21% in my data. That's okay. Okay, but you're not supposed to upload all the data you have and say and ask it to do anything, because you're disclosing patient information in an unsecured way. Okay, that is against all the data protection rules. Okay. So I think we have talked about all this. So as a surgeon, see, I'll just explain this to you from my perspective. So if you use a laparoscopic camera, okay, it gives the surgeon a view that could never be had with the naked eye. You'll see much more and much more detail when you do something laparoscopically, but it's still my hands or the surgeon's hands that's actually doing everything, that is judging what you see on screen. Okay, so in same way, AI and research is the same. It shows you things you wouldn't find alone, but it cannot replace the intellectual work of understanding what you see. Okay, so AI is a tool. It just amplifies your capability, right? Judgment is yours. You have to use your thinking and clinical judgment to do all these tasks. Okay. So this is just a repeat of everything. Okay. So the future doctor is basically AI enabled doctor. Okay. So how do you use AI? To find evidence faster, write clearer protocols, understand statistics, not do statistical analysis, to understand statistics, right? And to prepare for Viva. You can ask now Notebook LM to ask you questions, create Viva questions on a particular topic, and it will do this. So basically, I feel the doctors who use AI intelligently will outperform those who don't. Okay. And examiners already know this. Okay, so what are the key takeaways? So AI is a powerful tool. So tools require skill, judgment, responsibility to use well. Okay, use the right tool for the right task. Notebook LM for querying your papers, Claude or ChatGPT for writing and reasoning. Writing as in help you, not writing your paper, but help you refine. Okay, and Mandeley for references. Never use AI to generate data, fabricate references, or replace your own intellectual work. Disclose all AI use if you have used your guide and your dissertation. Transparency is what protects you. If you used AI, you have used AI. Okay. So your dissertation represents your basic competence as a researcher. Own every word in it. Okay. That is, write it yourself and own whatever you have written. Okay. So again, from my view, AI is like laparoscopy. It improves your vision, but the operation is still yours. Okay. So thank you. I'll take few questions. Before that, I'll just show you. I'll see if I can play the Notebook LM podcast. Just give me a minute. Another 2 minutes.
Yes, yes.
So until Dr. Ravi gets on to his on the video, so he has taken us through the process of these AI tools, the judicial use of it, how to use, when to use, which tool to be used, is what he has turned in a very systematic and meticulous way, organized his presentation. And we thank you, Dr. Ravi Kiran, so much for this, for your effort in letting our postgraduate students know what is right and what is wrong, which tools to be used. And thank you so much for that. Now, Dr. Ravi has told us all these. So it is on the part of the postgraduate students to realize these, that the artificial intelligence comes with some responsibilities.
Correct.
So you have to protect the data input. You have to disclose to your guides. And first of all, you have to find out whether you're authorized to use the AI in your thesis as per your university and the institution rules. And further, once you're authorized to use, then it comes with responsibilities. So you have to protect the data, and then you have to reveal that you have in which part of the thesis, in what way the AI being used has to be documented. That is very important. Also, you have to find out how much of percentage of AI can be used, how much it should not exceed, or how much. Okay, on to you, Dr. Ravi. Yes, we're ready.
So I'm just going to play the podcast that AI has created. Okay.
Internal organs suddenly got wrapped.
Can you hear, ma'am?
Yes, yes. Little louder volume.
So imagine your internal organs suddenly got wrapped in
So this basically,
double-sided sticky tape.
Yeah.
Okay.
Normally, naturally slippery, gliding effortlessly past each other as you go about your day.
Right.
But this stick basically locks everything in place. Welcome to the deep dive. Today, our mission is to unpack a medical study synopsis from Jawaharlal Nehru Medical College. We're looking at a really painful, hidden medical mystery, finally mapping them out.
The scale of this sticky tape problem is staggering, honestly. And they don't just form random.
so basically it has created 10 minutes of a podcast.
What is the source? Because it said
The
JNMC.
synopsis I've uploaded.
Synopsis.
Okay.
Dr. Ravi's
Acha.
synopsis. It is.
Synopsis. Podcast is generated based on your synopsis.
Based on my
Okay.
synopsis. So I can listen to books, I can listen to anything I've uploaded on Notebook LM. Okay. So basically it's a
Okay.
10-minute podcast where two people are discussing.
Significant handling.
Right,
Okay.
that makes
In fact, one retrospective cohort study we looked at showed that utilizing laparoscopy reduces adhesion-related readmissions by 32% compared to open surgery.
Okay, so laparoscopy gets the camera in there safely. But just seeing a messy web of scar tissue isn't enough for a rigorous clinical study.
No, they need an objective metric.
Right, they're basically conducting a highly structured property damage inspection for your
So that's, I think, the review of literature part that they're
Review of
discussing.
literature. Yes. Very interesting.
Okay.
Mm.
So Notebook LM that way is very good. You can use it because it's not going to hallucinate and it's going to use whatever you have uploaded. It's like your study partner. So it'll make a PPT, it'll make a video, it'll make a mind map. Mind maps are very useful when you're trying to read. It's like to formulate your thoughts. And so I think all of you can try to use all these and explore. Yeah, thank you.
Yeah. Any questions from the participants? Very interesting, as Dr. Sumana put it. Very interesting. And once we start working on that, I think we will have more understanding. Right. So this has been a
Yes,
very
ma'am.
good sensitization session, and recordings will be shared with all of you. Yeah. Any questions you have? Yes. Rita. Yes, please.
So thank you, sir, for giving this knowledge about all AI and their usage. We hope it is very useful for us, definitely. As a beginner, as entering into the PG, I'm a first year PG, still not yet started with my research works and things. So first to know the knowledge, we should know we should test ourselves. So for testing our knowledge, like regarding answering MCQs or to generate a question bank for us, which AI can be helpful, which we can actually rely on it. Can we use notebook?
Notebook LM. Yeah, yeah.
Okay.
So here, I'll just share my screen again. So here, if you see, there is a quiz.
Yes, sir. There is a quiz. Yes. After seeing
So you
that
click
only
on quiz
yes, sir.
and you can give it instructions.
Okay.
Okay. Easy, medium, hard,
Okay.
and say generate.
Okay.
Okay. So
And give
it's
that-
again, this is generating on the PDF that I've uploaded. If I have typed
Okay.
something wrong in my synopsis, it's going to give me wrong answers.
Wrong. Yes.
Okay.
It's only whatever you have uploaded. So if you uploaded wrong data, it's going to ask you wrong questions, give you wrong answers.
Okay. Okay. Okay, sir.
Okay.
So whatever
it's
we
generating a
need,
quiz.
okay, whatever
Yes.
we need, we have to upload the data from which we need the quiz. From there we can
Yes.
take it. Okay, got it, sir.
Yes. So you can create a video, you can do many things. Okay,
Okay.
you can, I think all of you can explore this yourself. Okay. So
Can-
compared to other AI, Notebook LM that way is better because it's not going to hallucinate. It's going to use the data that you have uploaded and it's going to basically help you read that better and understand better.
Okay.
I think,
Yeah.
see, it
Can
has
I
made
add?
the quiz.
Yeah. Okay.
So it has made a quiz.
Hmm.
According to the source material, what percentage of acute small bowel obstruction are attributed to post-operative adhesions? So it has made a quiz. I think it was 75%. So I'll click on that. See.
Okay, sir.
Ravi, I just want to add for multiple choice questions, as he has rightly said, one is uploading the data and verification and validation. Usually we should, yeah, especially in the medical education, you can validate with 2, 3 faculty, the answers also, most appropriate answers that can be done, but definitely it saves so much of time.
Yeah, once you have read a chapter and you want to know how well you remember it, you can upload the chapter and ask for the
Yes, exactly,
MCQs
exactly.
pre-prepared.
Okay.
Yes.
Okay, thank you.
Self-learning. Yes,
Yeah.
self-learning. Any other
Thank you, sir.
questions? Yeah. Anybody else has any question? I think that's it. So Dr. Sumana, thank you, Dr. Ravi and Dr. Sumana, for a wonderful, good seminar, great interactions, great inputs from you also. And Dr. Ravi, as always, I told you, he had taken, your topic was euglobulin lysis time to determine fibrinolytic activity in diabetics. He used to come early morning, collect the blood, fasting blood glucose, standing outside the clinical lab, and lot of hard work. So I have known him from the beginning, and he is growing with the subject. And if you remember in my first talk, I said every 75 days the medical knowledge is undergoing change, and this man is running with the new knowledge. I observed him, and so it's nice to have him in our team. And thank you. And Sumana, as I said, she is also rare pathologist. I have interacted with her very
Okay.
closely, and she has interacted with Boston universities and all that. I remember she had one query from the International American University where they were not able to diagnose, and she gave a solution to that. So good, Sumana, to have people like your
Thank you.
stage along with us. Thank you very much. We now move on to another last and interesting session. This session is no PPTs here. It will be interaction. So I would like to invite Dr. Ganavi, Dr. Chinmay, and Dr. Sujit. Please come on the video mode. These are our panelists, and why I have our team chose this session is that we spoke of so many things, and we say you do it. Dr. Ganavi, are you there?
Yes,
Ganavi,
ma'am.
can you come on the video mode? Yeah, yeah.
Yeah, yeah.
Dr. Sujit, you are there, right? Please come on the video mode, Dr. Sujit.
Yeah, ma'am.
You are there? Ah, yes. So I will just introduce them. They are our youngest among all the 5 resource persons we had all these days. Youngest but very valuable resource persons, right? So we have Dr. Okay, is a slide visible? No. Okay, I'll just introduce them briefly. We have discussed about so many things, and these people have worked very sincerely on their dissertation. Let us understand how they got through and what were their challenges. Is the slide visible? Yeah? Yes. So he is Dr. Sujit Pamujula. Am I pronouncing it correctly? Yeah,
Yes,
right?
ma'am.
So got logged off. I don't know how. Okay. Next is we have Dr. Chinmay. Is the slide visible? Is it visible? Am I audible?
Yes, ma'am.
We know, yeah.
Yes.
So she is Dr. Chinmay. She is doing her MD in dermatology, and she was a junior resident. She is now at KIMS, and she is also a research scientist. I was in my first lecture. I was referring to Precision Medicine, one of the company which is doing on tuberculosis. An excellent work is this HealSec Precision Medicine. She's working with them for the past 3 years. Chinmay, I think.
Yes, ma'am. Now currently in PG, I'm not M2, but still as a consultant,
Okay.
external consultant.
External. Okay.
Since the
Immuno-
company started.
Okay. And she is working on leprosy. She has worked on leprosy biomarkers, vitiligo, psychodermatology, AI in dermatology. Her key work is in tuberculosis, serum, IL-15. She's still doing her PG, mind you. She's giving exams in July, August. And presentation at Global Vitiligo Foundation, American Academy of Dermatology, presented various state and national conferences, dermatology quiz winner. And her vision is bridging immunology, biomarkers, holistic healthcare, and AI to enable predictive dermatology and all-round patient well-being. So very clear about her future. She has a clear vision about what she intends to do. Therefore, we have chosen these two. And third one, so Chinmay has been my student at Vaidehi Medical College as an undergrad, and she is student of Dr. Nandini, who was the chairperson for our first session. And Dr. Sujit is associated with Dr. Ravi Kiran. Therefore, we have him on this panel. Dr. Ganavi was I know her since 3 years. Postgraduate, she has completed her MD pharmacology from Hassan Medical College, MBBS from Kodagu, and she is a third rank holder at Rajiv Gandhi University. She has completed. And she has interned with me with Akshaisarathi Healthcare Solutions. She was an intern here for almost 6 months. And she is now clinical and medical affairs specialist at Teleflex India, support clinical education, evidence generation, stakeholder engagement. She is involved in training and scientific communication for interventional access and vascular interventions portfolio. Basically, she is contributing to the development of a medical device. And what I appreciate is she got numerous opportunities, job opportunities, of course, in industry, in the pharma, but she she was very strongly holding that she wants to be in something which is unique, and and she waited for it for quite some time and gave up all the opportunities. In fact, she was a little anxious, but finally she was chosen among many for this job at Teleflex India. And she has been medical officer PHC at Hassan Healthcare Center. And she has published as author with multiple research papers and clinical studies on cardiovascular and respiratory diseases and tuberculosis. One of her thesis has been on tuberculosis. So with that, now we move on to discussions. They are all on the screen. You can see them. Let me start with this question. What was your research topic? And Dr. Sujit, what was your PG topic?
Mine was about it was a comparative study. So I have compared a drug called esmolol and dexmedetomidine to know the effectiveness of its hypotension in ENT surgeries, basically FIS and septoplasty surgeries.
Okay, esmolol and dexmedetomidine.
Dexmedetomidine.
So you compare these two, is it? Okay.
Yes.
Okay. Why I'm asking is a similar research question we had given to our students. So follow-up, what was the follow-up like? How you followed for post-operative hypotension?
Not post-operative, intraoperative.
Intraoperative.
Yeah.
Okay, very good, very good.
So
And,
as I worked in this thing, corporate setup, so the patient's follow-up will be it will be very tough because the patients get discharged the
Correct.
next day. So
Correct.
I had to choose a topic which will be get done within the OT itself.
Right, right.
So
Perfect.
I have to associate with that.
Very good. Very nice. And how did you find your topic? You yourself found your topic, or your guide helped you, or how was it?
So I had some 3 or 4 topics from my side, ma'am, but the finalization of the topic was done by my guide,
Guide.
who's
Okay.
HOD, is our HOD.
Okay.
So while choosing those at the time when I chose these topics, yeah, ENT cases were at the summit, so I had to
Okay.
choose this. Yeah.
So you that very useful information. You chose your topic based on the availability of patients and your liking, right?
Yeah. Yeah.
And out of these 3-4 which you chose and took them to your guide, this topic was one of them.
Yes, ma'am.
This was one of them.
One of them.
Okay. So you shortlisted, and then you asked your guide to choose one of the best. And
Yeah.
one of the reason was availability of your patients and the time. Right.
Yes.
Very good. Very good.
So
Have you
whatever I had to do, it has to be within that
Within
few
that.
hours of interaction which I get with the
Correct.
patients. So
Correct.
So I've
Excellent.
gone through the data from the past 2 years, all those records, anesthesia records. So
Okay.
through those datas, we have summarized that these topics, these cases are mostly happening, and these many cases will happen in particular month. So like that, I have taken a call on choosing the
Okay.
topic.
Great, great. Very useful information. You have validated what we mentioned in our actually initial introductory sessions. Over to you, Chenmai. What was your topic, and how did you choose?
Yes, ma'am. So my topic was serum interleukin 15 levels among vitiligo patients versus that of healthy controls. And so this was actually, again, I was honored to have as my guide, Dr. Nandini, who was here with us in the earlier sessions this week. So she herself is a powerhouse of multiple topics. So she was quite clear when I was assigned. She said, no, this is a topic that's catching on because interleukin 15 is an up and coming marker for vitiligo, for the autoimmune memory T cell. So she was very clear that you have to study this molecule. And personally, I was very interested in vitiligo. Like personally, also in our family, there were so many people who had this condition. So definitely something that could contribute to furthering the management. So definitely in my case, I would say it was my guide who definitely kind of narrowed it down and
Narrowed
helped
it down.
me kind of streamline, because I was coming from the research background from the Indian Institute of Science, working in the company. So when I first joined here for post-graduation, I should say I had like a lot of wild ideas, didn't really know how to funnel it down to a postgraduate and like something that's feasible on a day-to-day basis. All the ideas. So one day she sat me down and said, look, these ideas can't be implemented at this point where you have to finish OPD, you have to finish rounds, you have to do academics, all of these things. So definitely a senior, the right guide, if you have the right type of guidance, they'll definitely help you narrow down your vision without making you feel demotivated or so that is definitely very important in my case, ma'am.
Great. How many patients you had to study? As
per statistician, I got a number of 40 plus 40. So 40 vitiligo and 40 healthy controls. And for the serum interleukin 15, I had to procure the kit, ELISA kit. So it sort of worked out because one kit has 90 wells, and by the time all the controls are filled up, it comes around to roughly 85. So the sample size also, I was able to manage it with one interleukin kit. But the collection of samples and all that took a couple of months.
So it was a cross-sectional study, right? At one
Cross-sectional.
time. Cross-sectional study. You collected the samples. Was there any specific time when you had to collect the samples?
So ideally, I wanted to go for untreated samples, like patients who had yet to start their treatments. But initially, I used to scrutinize. But the problem with the skin condition like that is they usually try everything else and then they come to us.
Right.
So by then, the signature would have got altered. So as I went on, I had to kind of improvise, and I just decided if they're not on systemic immunosuppressants, I would enroll. So it's a bit tricky to enroll that many number of patients in a particular time frame. Despite the high load that we have at our OPD, it was still quite tricky, but able to manage it.
You were able to do. So what was the cost of the kit?
So the kit came up to around 23,000, like that.
23,000.
So
Were you charged above this, over and above this by the lab, your hospital lab?
so
No,
actually
platform?
I had to procure the kit. This is not a molecule that's routinely tested here. So I had to procure the kit and give it to our department. So in our hospital, the microbiology department helped with the ELISA kit running and all. So they were very helpful with that. So I
Okay.
did not
So
have
you
to
use,
go for it.
okay. You spent 25,000 approximately. That's all. They didn't
Yes,
charge
roughly.
you.
I had to
That's all.
help them procure the tips for ELISA, the tubes, the serum
Okay.
cryovials, and
Yeah.
also, of course, the technician had to stay after hours for a few of the analysis. So he expected a
Okay.
little bit of a, but not much, maybe in a few thousand.
Okay.
So maximum maybe around 27,000.
1,000. Okay. But it was worth it, I think, because the standard of quality of research is good with these
Yes.
kind of biomarkers, and it will get very well accepted in presentations and publications, I'm sure. Have you presented your paper with this?
Yes,
paper?
ma'am. This was what I had presented at the American Academy of Dermatology
Great.
last year.
Okay.
So I had
Okay.
a pilot set of about 20 plus 20. So that's what I had.
Okay. Okay. Great. Ganavi, what was your topic in MD pharmacology?
Hello, ma'am. Good evening. First of
Good
all,
evening.
thank you for the opportunity and the brief introduction about all the newbie panelists over here.
Yes.
And so my topic was evaluation of frequency and severity of adverse drug reactions in MDR tuberculosis, ma'am.
In
So-
MDR-TB. Okay.
MDR tuberculosis. Since the bedaquiline drug was included in 2021, there were very fewer reports about, the adverse drug reactions in MDR-TB on the patients who are on bedaquiline. So I was quite interested in respiratory medicine or in cardiovascular sciences. So my guide was interested in that, so I chose that. Yeah.
Very good. So the topic was given by your guide.
No, like first of all, we did sat and we discussed like whatever is feasible in our setting. So we were either going with the pulmonology department or general medicine department. Then we narrowed it down to tuberculosis. Yeah, we explored few of the we explored in nephrology area also. Then cardiovascular. Then we funneled it down to respiratory medicine.
Okay. So it was a cross-sectional study, right? Or did you observe them, followed them?
Yeah, it was a prospective study, ma'am. I followed them for about 6 months and few patients till up to 9 months. So because few patients were also having XDR, that was extreme. So XDR for them, we had to follow up for around 9 months. There was change of medications as well. So again, we have to follow up them. So about 9 months each patient, I followed up them for 9 months, ma'am.
For 9 months. How many
Yes.
patients you completed?
So my sample size was about 52. So I was able to reach around 9 samples.
59.
Yeah,
Okay.
9 samples.
You followed them up for 6 to 9 months.
Yes, ma'am, 6 to 9 months. So that in that case, I would like really appreciate the work of treatment supervisors over there. So we have 8 taluks in Hassan district. So all the taluks have treatment supervisors there.
Okay.
So I was in constant touch with them. So each of the supervisor will get around 8 patients. So it was easy for them to follow up and come in contact with them. So they were my primary contact. So if any patient had any adverse drug reaction, they would immediately call me up and inform about it. So if it is necessary to intervene, I would call them to the hospital over HIMSS. Or if it is manageable in a primary healthcare center, I would just directly talk to the treatment provider or the administrative medical officer there. So that.
Okay. So you collected the data both the ways, direct supervision of patients as well as from the
Yes,
TB
ma'am.
officers.
Yes, ma'am.
Okay,
Depends
that is
on
how-
the
Yeah, so it must have been, so quite a long duration, right? 6 to 9 months, but you did 59 patients.
Yes,
That
ma'am.
is really commendable. Yeah, good. Did you present this paper somewhere?
Ma'am, I'm yet to present
Yet
it,
to
ma'am.
present.
Yeah.
Okay. Okay. Did you all have orientation sessions in your institution when you started, Ganavi?
Yes, ma'am. I
Okay.
think you personally know Dr. Deepak sir, who is very much interested in research
Correct.
and all. He took that initiative of, a 3-day orientation session for
Okay.
all the PGs. So
Okay.
we had a great idea about how to go.
Okay.
And each and everything was explained to us in detail.
Okay. What about you, Chinmay? Institution had or your guide helped you?
Definitely, we had a single day training program by the institution, ma'am. But I guess in
Okay.
one day it was moderately useful, definitely,
Useful.
about the
Okay.
statistics. But
Okay.
to personalize it to our subject, definitely guide and department.
Guide will
is
help.
very
Yeah.
key.
What about you, Sujit? Did you have which institution, which hospital did you do your DNB? Manipal?
The one which Ravi sir is working right now,
Same
Manipal Hospital,
Okay.
Vartur Road.
Okay. Okay. Did you
Mhm.
have any structured orientation or any kind of no? Guide
No.
has helped you. Guide
Yeah.
has helped you.
Guide, and there was one academic coordinated from
Good.
anesthesia team. So yeah, with their
Okay.
help only I have done.
Okay. Anybody else, peer group or junior faculty or anybody? Did anyone else?
Usually the consultant who do the cases, yeah, they have helped
They
me
have.
with the collection of the
Okay.
data, everything. So yeah,
Okay. Okay.
and they have guided me how to go ahead with how to collect the data, what
Okay.
parameters you have to collect the data with. So yeah,
Okay.
they have helped.
So the thing is, apart from these orientations, which will only give you a direction, actually, what happens in the hospital is your guides, your peer groups, your seniors, their contribution actually helps you to practically conduct your dissertation. Am I right? Yeah. Okay.
Yeah.
So I understand all three of you have doubly checked whether it is feasible, particularly from Sujit also. And Chinmay, did you evaluate? He clearly mentioned feasibility, novelty, and all those. Novelty, of course, I am sure it was there, both Chinmay and Ganavi. Feasibility assessment, were you able to? Did you feel that I should have taken up a more feasible project or more easy project? Did you feel
Yes, ma'am.
that?
And sometimes it did
Sometime?
feel like that, mainly because I was determined to kind of take it till the end. So I was very strict with my. So it started from blood drawings, then serum separation. I went to the lab personally, -80 refrigeration, all that. So definitely it was tricky at times, but I enjoyed the process. It
You
was
enjoy doing
very
it. Okay.
satisfying, and it was a
Okay.
very interesting
Yeah.
process.
Okay. What about you, Ganavi? Don't you think it was a very cumbersome topic for
Yes,
follow-up of 9 months?
yes, ma'am. It
Yeah.
was quite cumbersome, and unfortunately, Hassan have a burden of MDR tuberculosis. So
Okay.
achieving the sample size was not a big deal,
Sure.
but following them up for 9 months, that
9
was a big
months.
thing. And you know,
Okay.
sometimes patients will report the ADR after few months, like they experience it in the first month of treatment, but they will not know about it after 2 months or 3 months. They'll be telling it. So again, assessing the causality was difficult, but it was not included in my study. But I was interested in checking the causality of relation with the drug also. So
Okay.
and so whenever the patients come to you, and again it's MDR TB, we have to be very cautious when we are
Correct.
examining the patients and all. Sometimes I felt maybe I would have gone for the easier one, but this was quite satisfying because we have very less data about MDR TB as of now,
Yeah.
especially about
Correct.
adverse drug reactions. And I don't
Correct.
think in Karnataka we have any data regarding adverse drug reactions as of now. So this would be a first study about it.
Definitely. Definitely. The topics all three of you have taken are definitely a very interesting topic. Very good. Feasibility wise, I think Dr. Sujit's was very comfortable doing intraoperatively and getting good to this one. Others, it depends on your how much time you are ready to give, how much time and how passionate you are about that. Otherwise, I think majority of the people, long follow-ups may be a little cumbersome. Better to choose easier ones. But if you take, I mean, it's directly proportional to your effort. See, Chinmay was able to present her paper in the American Dermatology Association. That adds a lot of credibility. And what do you think, Ganavi, this kind of effort which you put, very hard work, this was really a great commitment, what you have done. Does that help in your career or in the current job or any kind of job profile which you will be undertaking, which you have already undertaken? Does
Ma'am,
that still add value?
yeah, this project like easily landed me with the Zydus offer, ma'am. Actually, just by
Okay.
looking at the topic only, they wanted someone to a respiratory portfolio, and they saw this. And I gave only one round of interview, and I was there in front of medical affairs PP for the second round. So that was a big advantage for me. So I think, yeah, it helps, but it also depends on how do you see yourself, if you are interested in particular topic or if you want to pursue it after your MD also related to that therapy area. I think it would be advantageous, but it totally depends on the interest, ma'am.
Okay. No, that is related to the area topic. I'm talking about the skill or the effort that you put in following up with the patients, the communication, interaction with other people like TB officers. You had to have that contact, right? Otherwise, that wouldn't have helped. It was a totally, your interpersonal skills must have helped.
Yes,
Of course,
ma'am.
with your guide, but then.
There was a lot of, cross-functional team collaboration was there. So I was in very close contact with general medicine HOD, pulmonology HOD, and district tuberculosis officers, and most of the AMOs in Hassan district. So I was able to, understand the ground level reality, whatever they face, okay, in treating a MDR case. Sometimes the patient will not come for the treatment and all, but
Okay.
it's the doctor's responsibility as well. If any cases in that area, they are answerable for it. So I was able to understand the ground reality of treating a patient with MDR TB. That was there.
Okay.
And yeah, that is the main thing I learned. And obviously collaborating with various teams and just uh eh, explaining to the treatment supervisors why I am doing this, what is this, what is the importance of this. So that was also, and getting the data about each, and they'll be skeptical to give you the data because
Correct.
it's very confidential data.
Correct.
So that was initially, it was quite difficult, but we were able to get through it with the help of DTO.
Great, great. Dr. Sujit, this dissertation which was taken, what is your opinion? It is enough if we take a very, particularly for DNB students and clinical subjects and critical care. You have a lot of responsibilities in your hospital. So dissertation, how seriously it should be taken? How does it help in your clinical practice? Does it add value to your treatment care, patient care now what you're doing?
Definitely, it should be taken equally important as your academics, because
Okay.
all these research topics, whenever you give the public publication or when you publish in the other articles, so these are the based on these only they will perform the meta-analysis, all those materials, whatever the results, whatever the guidelines they make, it all go through these research papers. So from your side, when you do when you do a dissertation, you have to do it a bit fair, so that
Okay.
it will add up properly to the
Yeah,
pool.
correct.
So, and obviously, when you when you write a thesis or when you choose a topic for a thesis, so you will obviously go through some few few publications or few topics where you have to go through the material very detailedly. So on based on what parameters you have to choose, you will learn a lot of new things. What was the methodology? What were the tools they have used? What were the study designs? So you will get to gain a lot of knowledge from those topics if you show some interest.
Correct. Good, good. What about you, Chinmay? Do you think this kind of dissertation topics which you chose particularly, which is more research oriented and advanced, I should say, for a postgraduate, choosing biomarker in clinical subjects. So how does it add value to your future clinical practice or clinical career? Taking your dissertation, yeah.
Yes, Bob. So that's what, as doing it in the middle of a busy day and when we're actively doing a post graduation in the middle of seminars, all that, it is definitely challenging. But I think I learned a lot of people skills, like you mentioned. Having to, we only have 2 minutes. Like literally, I would have to ask for permission, step out of the OPD. Okay, I'll just take this patient for 2 minutes. We only have 1 or 2 minutes to convince this patient. Okay, we're doing this. Take the informed consent, do the checking, fill the pro forma, all that. Literally only have 2 minutes. So it depends how we convey what we're doing. Some of them say, okay, if you've done this blood test, now will my treatment change? So it's tricky to answer sometimes, to explain to people who are not very aware that this is a research question right now. So if we do this, maybe in the future, it becomes a therapeutic target. So it's difficult to convince. Sometimes they may be upset or they may say, okay, you did this, but nothing changed. All those myriad little things, definitely it helped me, like, I developed the patient skills more, especially in dermatology, where talking is like 60 to 70% of the therapy is just convincing the patient or talking or calming them down. So I think that aspect, because it was having to be done under such a high pressure environment, it definitely helped hone my patient skills. And also I got to do a bit of hands-on wet lab things.
Yes.
Serum extraction. I sat with the technician. He taught me how to do the serum extract, how to identify whether it's been extracted well, or a bit of both. But as for other postgraduates who don't have a very active interest in research, I would say it would become a little difficult, because in between they may lose the motivation to continue. If it starts looking difficult and they're unable to look at the bigger picture, it could become tricky. So in such situations, I think while starting out, we should be very clear about how invested we are in this, how invested are we to see this to the end, and not just finish it as a formality. So if it's being done with that attitude, I think the topic that should be selected should be a little lighter. So that is
precisely. This is what I wanted, actually. Yeah. Ganavi, so all of you achieved the target patient sample size, right? All three of you. What was planned? And any suggestions? Last thing is, based on your experiences, your challenges, what you felt, hurdles, give one suggestion to the PGs who are here, who have logged in, how they should, now they are entering. So what is your suggestion to make that dissertation enjoyable thing? It should not be a burden. They should enjoy it and come out with good results. What are your suggestions? Sujit, we can start from.
I think there should be a check month, like every monthly updates or 3 monthly updates to know where they are in the dissertation, so that they will not lose the track completely.
Correct.
So mine, it was very tough to what to say. There was not proper coordination between the guide and me, so I had to take every data at the end of my second year.
Okay.
So we will be we'll be submitting our thesis by the end of 2.5 years. So the time to do that many of the cases were also challenging for me. So when you keep in touch with when you keep updating those things every now and then you will have that interest and that zeal to do things. What things you can improve, what things you can improvise, what are the things you have done wrong with the previous case. So what could go wrong? So all these things you can have a discussion with your guides or co-guides, so that they can motivate you positively and go ahead with it.
So regular check is what is required, right? At regular intervals, keep a track and divide the patient. This interval, I'm going to have so many patients recruited. That will add value. You agree with him, Chinmay? Anything from your side? What is your suggestion to the PGs? One is keeping a track.
Yes, ma'am. So that definitely keeping a track is very important. And additionally, I would say, generally the mindset is, after we clear the entrance and we start in the first year, generally we are all quite confused, because it's a new subject, new environment. And in the middle of that, if the expectation is that we pick up some research topic which attacks directly at something that is missing.
Correct.
This is already an ocean. We already don't know anything, and now we're expected to pick up a topic that is supposed to say, okay, there is a lacuna in this area. So it can be very daunting, but I would say that you can see it as a way of falling in love with the subject that you've selected.
Yes.
So this is what we've gone through first the 4.5 years. We knew which subjects we liked, we didn't like. Finally, we landed up doing something that hopefully now we start liking, but it can be quite intimidating. So I guess selecting a thesis, it keeps you as an anchor. It reminds you that, okay, this is why I joined. I really like this topic. This is something that I find meaning in. I think I can contribute to this space. So it's not just for an RGUHS requirement, but it keeps you as an anchor through the 3 years. It reminds you that this is why I took this subject and I think I fit in here. So that keeping that in mind, if a topic would be selected, I think there would be no resistance or nothing.
Correct. That's great. Ganavi, what is your suggestion?
Yes, ma'am. As Chinmay rightly mentioned, it's important to understand what are your interests, and secondly, it is also important to know if it is feasible to conduct the study there, because after 2.5 years you will have to submit the thesis, which is very important for your academic progression. So it's important to understand if the study is feasible, if I'll be able to do it, because there are some branches which will give you no time at all for, conduction of the studies and all that time. I think it's important you go for a feasible, a basic one, which you can give justice as well, just not doing it for the sake of doing. So whatever it is, just give 100% of yourself conduction of the study, and understand, like, if you're choosing the topic of your interest, why? Because you will learn a lot about that particular area apart from the studies which you are doing, apart from the theory you are studying for your exams or the cases you're seeing. This thesis topic, you will be learning a lot more about it. So if you're already interested in it, I think it will be easy for you to learn more and you will enjoy it. So that's what I say. And understand the people you will be dealing with once you take up this study. If you're doing any cross collaborations and all, with the lab or with the other stakeholders, there it's important, okay, if it will be feasible for me, if I can deal with this, if I'll get the time to do other work also. So that understanding that is also important. So at the end of the day, if you're in clinical, the primary aim is to give the treatment and patient care. That along with that, you will have to take this study parallelly. So just it is important to maintain that fine balance about going for the newer topic and topic of your interest, along with that maintaining that feasibility. Yeah, I would say. Yeah.
Perfect. Excellent inputs. And I am happy I chose the best who have done very well in the dissertation. And I'm sure any questions from the participants, one or two we can take, and then we close. Any questions from the participants? Anybody would like to know from your seniors? They have done very well. And we can see from their, suggestions on how passionate they were. I think there is any question? Anybody has any question? Anybody wants to know?
Hello, ma'am.
Yes, please. Vinod? Yes, please.
I just want to ask mainly for the Ganami ma'am and Chinmay ma'am, and for the sir also. So the thing is, like, how did you run the test, the statistical test? Did you consult any statistician, or did you learn it by the any material or something like that? Or how did you do it, and how did you choose the variability? And already, definitely before doing the synopsis, definitely you would have selected the variability, what you have to do, what are the tables you have to look for. But still, how did you do that? Like, how did you choose it? Is it like, how did you manage it? That's the only question.
Yes, Ganavi, you can answer. Chinmay, you can answer. Chinmay. Yeah, one after.
Right. So there's definitely the statistical analysis. That's where the statisticians play a very big role. But what I've noticed is they need our help as well, because they will also not be fully familiar. Only we will know what the best in our subject. So they would be more like, again, like I think Dr. Ravi Kiran mentioned, like AI, they will also be a friend who will just do the analysis that we want. So while they were doing the analysis, I also was trying to read up about the different statistical tests and what should be used for this particular variable, what kind of comparison. So here again, I think AI does play a role, because at least we are able to understand what it is. So if we pull up an article, this has happened with me. They mention a bunch of very, very complicated sounding tests. We may or may not be familiar, and that just makes us more confused. So just looking up the individual exact tests, that just puts it in a very simple perspective. So using articles, Google or AI to at least understand what it is this test is doing before you approach the statistician. And then you have to discuss with the statistician saying, this is the output I want. I'm comparing these two. And then you have a to and fro discussion with the statistician. So everywhere there's a sort of active involvement from our side regarding our analysis and our statistics.
Let me tell something, Pratibha. So as Dr. Chinmay said, the student has to understand the statistical methods completely, and through your GI, AI or the Google, all that. And when you approach the statistician, you will have your doubts. So you can ask them, when the statistician says this is the method you're going to apply, then you can definitely ask it, why not this? And this is what I was told, so this is what I have understood. And why this and why not that? So they will also know that you know everything. The statistician knows that you know everything and you want the just right thing to be done. They also understand that, and they explain to you, so it becomes mutual, and you
Correct.
get the best out of it.
Okay.
So it is very important for a student to know the complete statistical methods and a prior sort of understanding. Okay, this must be the right thing for me. And when the statistician says no, this, and when you ask questions, you will understand it more. That is very important.
Yes, ma'am.
Thank Yeah.
Thank you.
Yeah. Any other questions? Then we can move to other panelists. Any other questions? I think that was convincing,
hello.
right? We know. Yes, Sagarika.
Ma'am, I have a doubt. I am a faculty in the college, so the first year PG has selected a topic, a biomarker, that is glycated albumin in GDM cases. It's a gynec topic, and she has inquired about, which is not routinely done in our hospital. So she has inquired about the procedures, all that, the kit charges, how to avail that, how much procedure cost will be there. So it's roughly about 1,000 rupees patient has to pay, but it is
Per
not
test?
feasible. Yeah,
Per
test
test.
for
Okay.
the test, because it is
No, that's
not
what per
routinely
patient.
done.
No, let me understand. Per patient, she has to spend 1,000.
Patient has to pay 1,000.
Patient has to pay. Oh,
Yeah.
okay, okay.
So
Yeah.
we have talked with our biochem madam. She will run the test, but patient has to pay. But it is not feasible that even we don't want patient has to pay so much. So is there any provision for any funding
Yes.
from the college we can apply for PG thesis? Is there any
Yes.
provision? Just I want to know.
Yes,
Or it is
yes.
institution based?
No, as you said, you can talk to institute like how Chinmay has done. She paid for the kit. So have a negotiation. Vaidehi also did that. Atal Bihari also said that, because wherever we go to institutions, the management is happy to, help you.
Mhm.
You have to talk to them and say, we provide the kits, get it done. They are happy.
Okay.
No problem. That is one option. ICMR is funding for PG thesis. They are
Okay.
going to call along with the student STS project. ICMR will call. I shared one MPS con also, but that is for pharmacologist. I think they are giving 20,000 per project. So your association, your specialization is ENT, right, Sagarika?
Gynec,
No,
ma'am.
OBG, OBG, that your Foxy and all will be, they will have some funding for postgraduates. Inquire that. ICMR gives, this one gives, and RSSDI has got. Research
Okay.
Society of Diabetes of India, they have for postgraduates. Keep a track on that. And these are some of the funding agencies. Best would be, before you wait, talk about, negotiate with the management. We provide the kit, and that much you have to spend. Some 20,000-30,000. Postgraduates, if they invest, it will be a very good research project. Otherwise, it will be very superficial, and because for such subjects, biomarkers, and all. Otherwise, you have like intensive care, you have a lot of clinical material. You can do research without biomarkers also, but choose a proper topic. But as I said, feasible one. So this is regarding the investment, right? Okay.
Yes,
Thank you.
Pratibha ma'am.
Yes, ma'am.
This was what she's asking, like how, like Dr. Chinmay said, did it in her topic. The cost of the kit only has to be, you have to inquire from the biochemistry department how much the kit cost would be. One, first of all. Then the technical aspect, performing it, that should not be charged. That is from the institution has to bear it, because it is for the institution also what is being done. Then when the test kit cost is understood, again, who is the supplier of the kit? You can, the kit who supplies, you can talk with them and say this is for a research purpose. And talk to them also. This is for the research purpose we are doing. And so you could, give it at a subsidized cost. It can be negotiated at that end also. And so those companies who are supplying also would come ahead and try to, reduce the cost and give it at a very minimal thing. And that way it can be reduced.
Yes. And some of the clinical labs may not do some of these interleukins and all that. Akshaisarathi has tied up with some research labs who have agreed to do at some minimal cost. If you want, you can write a mail to us. We will connect you with those labs which are doing ELISA based test at minimal cost for postgraduates. Because if none of these happen at your institution, we can arrange for transportation, pool all the samples, send it, and we can get it done. So that option also I'm giving, but first to try in your institution. What Dr. Sumana said, all those, negotiate with the thing, because locally you should do. worst situation? I mean, you are at Sagarika, you are at Coimbatore, right?
No, ma'am, I'm Bhubaneswar, ma'am. Orissa.
Bhubaneswar, okay.
Yes,
Okay. Your
yeah.
institutes, yeah. Which institute is that?
KIMS Hospital, ma'am. Bhubaneswar.
No, KIMS is
Kalinga Institute of Medical
Kalinga, they will
Yes.
do. They're very advanced institution.
Yes, ma'am.
Top, one of the top it is actually in the rankings.
Okay.
So they will do.
Yes.
Yeah, they will do. 100% they will do.
Because PG is also very much interested to do this topic.
Yeah, then you talk to them, negotiate the price, and then you can do that.
Yeah. Thank you, ma'am.
Yeah.
Yeah.
Anybody else? Any other queries? Okay. So thank you very much, all the panelists and all the. Can all of you come on the video mode once? Can all of you come? And Ravi, can you take the screenshot? Can all of you come on the video mode quickly? Quickly. Yes. Good. I saw Sagarika for the first time on the video. Yeah. Come. Vinod. Yeah. Please. Others also. Sumana, please come. All of you come on the video mode, then we take a screenshot. It is nice to see everybody on the screen. 9 people are yet to join. Please come quickly. Don't hesitate. It's okay. Whatever be the background, whatever, even if you are in a car or outside, just come on the video mode. Ravi, can you take a screenshot
Yes,
with this
ma'am.
much? Yeah. So thank you, everyone. And I don't know, I hope all of you have enjoyed these sessions for 1 week. It was our first experiment, and my mentor is Ravi Kiran Andra, you know. I call him my mentor. It was his idea that we do it in the evening online because we wanted to have it offline. And he suggested, let's do. And Ravi, I think to a great extent it was successful. I'm sure you would have enjoyed, right, Vinod? I think it was effective to some extent. We are also learning. And thank you very much. And with these inputs, I'm sure you will do a very good job. Wishing you all the best. Wish all the panelists also very best in your career. And we are happy to be associated with you guys also. And please continue to be with us. And others also, if you want to join us in any of our endeavors, we are happy to involve you also in one or the other way. You can get an opportunity, because I feel every opportunity gives us more learning. And see how I learned AI from Ravi Kiran, how I learned from Sujit and Chinmay and Ganavi. It's really nice, you know. Wishing you all the very best. And thank you once again. Participants will share the Google form in the WhatsApp group. Please answer those. Only when you complete those answers, you will get the certificate. And you can refer and answer. No problem. You can refer and answer, because anything is learning for us. All right. Thank you. Have a great weekend, all of you. Namaste. Thank you. Thank you.
Thank you.
Thank you, ma'am. Namaste.
Thank you.
Thank you, ma'am.
Thank you, ma'am.